On the phone today, did President Biden ask President Xi anything about getting to the bottom of the origins of COVID?
On the origins of COVID, the two presidents did discuss the health security, and transparency is key part of that. As we have repeatedly said, the PRC is not living up to scientific and public health norms for data and information sharing. We have said this before, so that is nothing new. And the international community, we've said this, needs more data, they need more information to make clear the determination on the origins of the pandemic. We continue to work with our partners around the world to press China to fully share information and to cooperate with the World Health Organization. So this has come up many times before.
I know it's come up before, but it came up today.
I'm just saying that the two presidents did discuss health security. That did come up.
That was Fox News' Peter Doocy there, probing the White House press secretary on President Biden's phone call with Chinese President Xi Jinping. We are 3 years into the coronavirus pandemic and still have no definitive answers on how the virus was originated. It is likely the virus came from China, given that's where the first case was detected, but the Communist Party haven't exactly been forthcoming with answers. Joe Biden and Xi Jinping had a phone call that lasted more than 2 hours today. The topics that were discussed were Taiwan, the two countries' relationship, health security and climate change. But what about the origins of COVID, asked Peter Doocy. Did the president ask the Chinese leader whether there was an update on how the virus came to be? Not exactly, says Karine Jean-Pierre. She attempted to explain that the two leaders did discuss transparency when it comes to health security. The press secretary said the Biden administration is continuing to press China on releasing data and being more transparent about the virus. But when it came to the actual one-on-one phone call between the two, it's looking like that wasn't really discussed. Earlier in the week, a former CDC director spoke on the origins of COVID-19, where he disagreed with Dr. Anthony Fauci's understanding of how the virus came to be. The two main theories, of course, are the virus either originated from a lab leak in China, either as a mistake or with the intention of being used as a bioweapon, or the virus originated naturally. Dr. Fauci has said that he's keeping an open mind that coronavirus could have originated from a lab in China, but believes it looks very much like this was a natural occurrence. Former CDC Director Robert R. Redfield does not fully support Dr. Fauci's hypothesis. He told the story that when you compare COVID to past viruses that became an epidemic, none of them became as contagious in a human-to-human way than COVID-19 did. So it's really exceptional. This virus was one of the most infectious viruses for man, and I still argue that's because it was educated how to infect human tissue. He also pointed out that it was speculated years ago that the same lab was training bat-borne viruses to jump to humans. I'm disappointed in the NIH for not leading an objective evaluation from the beginning. I think it really is antithetical to the science, where they took a very strong position that people like myself, who are somehow conspiratorial just because we have a different scientific hypothesis. In June, the World Health Organization recommended that scientists investigating the origins should continue to research all possible hypotheses, including the lab leak theory.